We're joined now by one of the top public health experts in Florida. Dr. Donna Peterson is Senior Associate Vice President for USF Health and Dean of the USF College of Public Health. She's also on the USF President's Task Force regarding COVID-19. And Dr. Peterson, thank you for coming by WEDU.
Thank you, Rob. It's a pleasure to be here. Does
it make sense? Do you think that the politicians are right, the local politicians are right, that we do these shelter-in-place orders? Is that the best approach, or what do you think about the governor's approach to leave it up to local communities?
Well, I think we all appreciate that these are challenging times, and we want to make decisions that don't cause more harm than the good they are trying to create. But we know in this particular case, not unlike other infectious disease outbreaks, we have very few tools available to us. So we have tried to increase people's awareness, provide education and information and guidance to help people behave in ways that will prevent the spread of the disease. There's no engineering solution right now. There's not protective equipment we can give to people to wear so that they can go on about their daily lives. And so we're really only left with policy directives that keep people away from each other. And that's what we're trying to do. The best way to prevent the transmission of this particular virus is to keep people a safe distance from each other. Mm-hmm. And I think we can ask people to do that, and we have. Some of the measures that have been taken are designed to help people make the right decision and stay home. We can beg them to stay home, or we can, in effect, direct them to stay home. And so I think these orders at this time, as the virus continues to spread, as we continue to see growing number of cases and potential strain on our healthcare system, that it's the right thing to do at this moment.
Would you expect this crisis to be on the wane by Easter?
If we look at what's happened in other countries and even in other states within the United States, no, I do not expect this to be on the wane by Easter.
Whose track are we following? Are we following China's track and Japan and South Korea, which have peaked and leveled off and their cases are diminishing, or are we following Italy and Spain?
Well, the data is pretty clear. We continue to increase. We continue to see case numbers go up. They're not going up at the same rate, so the rate seems to be slowing down, which is hopeful. But we are more on the Italy track than the China track right now.
How contagious is the coronavirus compared to the common flu or the common cold?
Well, I'm glad you said flu, because we're not really sure how contagious the cold is, other than that we all get colds. But the coronavirus, we are learning more about it every day. So the more cases that emerge, the more communities it affects, we're able to collect more information, we're able to know more. So we believe that the ability of the virus to be transmitted from person to person, what we call the R0, not to get too technical, but so the R0 is a measure of one infected person coming into a community that has not been exposed to the virus. That's how we think about this. And R0 less than 1 means that one individual is transmitting the virus to less than one other person. So that means it's on the wane. That's where we want to be. And R0 above 1, so you can do the math, right? If it's 4, then if I have the virus and I go into a community where the virus hasn't been seen, 4 people are likely to be infected by me. Mm-hmm. So right now, the R0, we believe, is about 1.5 to maybe 3.5, somewhere in that range. The flu, the common flu that we get every year, is typically in the range of 2 to 3. So we're roughly, again, we learn more each day, but it seems to be about as transmissible as the flu as far as we can tell.